Hi there. Oh, my name is Karen Kennedy, and I'm a certified nutritionist and the blood sugar hacker. And today I'm going to be talking to healthcare providers who want to learn more about using a continuous glucose monitor in clinical practice. Specifically, today I want to talk about some of the legal issues with off-label prescribing, and even more specifically, I want to support dietitians and other nutritional professionals in requesting prescriptions from their patients' doctors. But first, I think it's helpful to understand what off-label use is in terms of drugs and medical devices. And once you understand that, it makes more sense about how to request these prescriptions. Okay. I'm aware that the timing of the schedule of this live was a little wonky. I'm chronologically challenged this week, apparently. So I will check the questions in the comments later and I will respond to them. So sign in to StreamYard if you want to ask me questions here and now on live, but if you're watching on replay, I'll be checking those comments. So let me share my screen. This is a really interesting topic for me. I've had a lot of questions about it, and I did a little research. So before we start, I want to tell you who I am and who I'm not. I'm a certified nutritionist licensed in the state of Washington. I'm a certified practitioner of integrative and functional nutritionist, and I'm good at using continuous glucose monitors. I am not a certified diabetes educator. I am not affiliated with Abbott, Dexcom, or any other company. Nobody is paying me to do this. I have no disclosures. So no one is paying me. You will learn, I'm hoping, some of the standards of off-label prescribing. And if you are a prescriber, you know all this already. So you can just skip over this and understand, get to the points that are specific for continuous glucose monitors. Some of the legal concerns of off-label prescribing. If you are not a prescriber and you are a nutritionist or dietitian, this is helpful for you to understand where your prescribing doctors are coming from. And then I want you to know how to request these. I want you to be more confident in communicating and coordinating care with your patient's primary care provider and prescriber. So I manage a Facebook group that supports clinicians using continuous glucose monitors in their practice. And a while back, I polled them, what's holding you back from doing this? What do you need? And the number one is requesting a prescription from the doctor. People feel really uncomfortable about that. And I wondered why. And so I did a little asking around, a little researching, and I think this is what it is, understanding the whole off-label use and learning how to communicate with providers in a way that's professional and is a win-win-win for you, the prescribing doctor, and your patient, of course, which is the biggest win. So let's talk about off-label use. This webinar is going to be brief. I'm going to try to touch on some topics. I don't think I'm going to go into huge depth, but hopefully enough that it'll show you what you need to do your research on and give you some more confidence. This is a quote. Off-label use of medical products is the practice of prescribing drugs and biologics and using medical devices, which is what a continuous glucose monitor is, a CGM, in a manner different from that approved by the U.S. Food and Drug Administration as safe and effective. Okay, so all these devices, drugs, were all approved by the FDA as safe and effective for specific use. Using them off-label is using them for something else besides what they were approved for. So if you're a prescribing physician, duh. But if you're not, this might sound a little dodgy to you, but it's not dodgy, and I want to tell you why it's common, but I want you to understand a little bit more about it. Off-label prescribing is very common. I saw a quote that said 1 in 5 prescriptions written today is an off-label use. It's frequently beneficial and often the standard of care. Just because it's off-label doesn't mean it couldn't be the standard of care. It often is. But be mindful that it can also pose a risk of harm to patients and liability to providers if evidence is not there for safety and efficacy is lacking. But know that the legal issues with off-label use of prescribing, The action taken is, I think, more commonly directed towards manufacturers. So let's say Dexcom or Abbott make these continuous glucose monitors. They are not allowed to market their off-label use. They can't just go to doctors and say, hey, I want you to prescribe this to anyone. Everyone could use this. No, that's the FDA regulates them. The FDA does not regulate doctors. And in fact, Congress has taken some action to protect providers to make it easier for them to do off-label prescribing, because they know this is how we progress, this is how we learn, this is how we help more people. All right? So you can learn more about that on your own. But here's an example, a really good example. Metformin, and if you're listening to this, you know what metformin is, because metformin is a very popular drug for type 2 diabetes. And every time I'm talking about diabetes, in my case, I'm talking about type 2 diabetes, which is, of course, very different from type 1. Metformin also, this is a quote, also has several non-FDA approved indications, including gestational diabetes, management of antipsychotic-induced weight gain, type 2 diabetes prevention, and the treatment and prevention of polycystic ovarian syndrome. So metformin is only approved for use by the FDA for use in type 2 diabetes in a certain population. Every other use is off-label for use in kids, for use in pre-diabetes. See type 2 diabetes prevention, it says here. So that's pre-diabetes. It was not approved for that. And yet it is used extensively. It is also the standard of care, I believe, in pre-diabetes. Metformin is, right? So this is what I mean. Off-label use isn't dodgy. It's appropriate many of the times. So let's understand what the whole FDA approval thing is for. If they can just prescribe it willy-nilly, it seems like, well, they can do this with anything. FDA approval for a drug or device is expensive and time-consuming. A manufacturer needs to establish safety for a drug or device. They need to understand the mechanism of action and establish effectiveness in a target disease and a target population, right? So think about this. This is very expensive and time-consuming. A manufacturer really needs to, they really need to show that something is effective and make it safe. So are they going to test this in a population of people who are compromised? No, they're going to test this usually in adults, healthy adults, often men, usually men, because they don't have a menstrual cycle to be factoring it as another variable. So they're not going to spend time testing it for all indications and all populations. They need a slam dunk. Get it approved, make it legal, make it safe and on the market, and they need to put it in doctors' hands. Full stop. That's what FDA approval does. But again, the FDA does not regulate doctors. It regulates the drugs and devices and the manufacturers. So once it's approved, doctors may prescribe it for other indications for which the product might be useful. So examples, classic examples of this that happen every day are metformin. And I mean, there's so many examples of off-label prescribing. Like I said, around 1 in 5 prescriptions are off-label. What are some indications for off-label use? Why would physicians do this? One, they would use it in populations not studied. For example, if the FDA approved it based on research done in adult men for this specific condition, obviously they're going to try it in women. They're going to then, extrapolate that into pediatric patients. They're going to have to play around with the dose. Pregnant women, it's not FDA approved for pregnant women, but they might try that. When the mechanism of action makes it applicable. So, and also for less severe forms of the disease it's approved for. So that's where like metformin comes in, which is a good example since we're talking about blood sugar regulation with the continuous glucose monitor. So when you know the mechanism of action and you think, okay, where's that mechanism of action also playing a role? Those are the indications that it might get used in an off-label capacity. The manufacturers of these drugs and devices will not seek further FDA approval for other indications. I mean, I didn't research this, but why would they? It's expensive. There's not the cost benefit profile is not in their favor. So once it's approved for something, it's not worth the money to run another clinical trial. So indications will start to be laid out by peer-reviewed research. So medical institutions will run studies on this. Even for continuous glucose monitors, I believe the companies like Signos and Levels, I think they're running studies on off-label use of CGM in non-diabetic populations. There'll be case studies published by practitioners, and eventually enough data will get produced that there's a standard of care, and there'll be recommendations by like the American Diabetes Association, the Heart Association, and other associations that represent certain conditions. Remember, they'll be saying, this is standard of care. This is what we recommend. This is our top recommendation for this indication, but it could still be off-label. So it's not as dodgy as you think, but physicians still have responsibility, right? So I know there's this hesitancy of approaching physicians for things, but and I get it. If you're working in a hospital setting, there's a hierarchy, but physicians are busy people just like you. They did a lot of training and study because they want to help people and get good outcomes for their patients just like you. But they have some extra liability that they need to be cautious of for prescribing and diagnosing. So they need, for off-label prescribing, to evaluate whether there's sufficient evidence to justify off-label use. They need to press for additional information and research when adequate evidence is lacking. And they need to make sure patients are informed about uncertainties, risks about their health, and potential costs associated. These are all the legal issues with off-label prescribing. Why do you care? As a non-prescriber, you need to know what physicians need to know because you're the one who needs to advise them. Consider yourself a consultant. Like a GP, if you're writing a letter to a GP asking for a prescription, that a general practitioner, they have a lot they need to keep in their minds for a very short visit. So if they aren't familiar with off-label use of continuous glucose monitors and their benefit or their costs or which one to prescribe, you need to inform them. That's your job. So cost effectiveness, safety, and informed consent share decision-making. Those are three key things that physicians need, and you can give it to them. They're busy people. You can help them with this. I want you to know that this is what your prescriber needs because you need to give it to them in the letter that you provide requesting a prescription. Cost effectiveness, safety, informed consent, and shared decision-making. Okay? So this is how we're going to put this into practice. Your prescriber is going to be a doctor, a physician's assistant, a nurse practitioner, something like that. Doctors are busy, they are mindful of liability, and they don't know you or trust you. So give them the information they need so that they can use it very quickly because they have their days chopped up into 15-minute segments. My goodness. You need to give them what they need to so they're mindful of their liability, and give them evidence so they trust you. Be a trustworthy person. They want good outcomes. Help them. Tell them the indication of need. You're just writing them a brief chart note. Give the evidence of need and effectiveness. My patient has increased waist circumference, high triglycerides, and slightly elevated A1C. There's clearly a need, indicates pre-diabetes. I'm concerned that if they do nothing, this will progress into diabetes, heart disease, blah, blah, blah. I find using a continuous glucose monitor for a short period of time to be very effective in educating them, providing accountability, blah, blah, blah. Assurance that the patient has been informed of the price. You can tell the physician, I'm recommending a prescription for this monitor, this prescription code. It costs this much cash as a cash pay. Insurance may or may not cover it. Please run it through insurance, but be aware that I have informed our patient that this is the cost and they are fine with that. That is showing shared decision making with your patient, informed consent of the price. You see what I mean? And giving the doctor that need and effectiveness as evidenced by those kind of statements. Little note here, doctors probably hate charting as much as you do. Make their job easier, not harder. Let them know that you will support the patient to interpret the data, right? Because continuous glucose monitor is helpful. The data is helpful, but if you don't know what to do with it, sometimes it can just cause anxiety. Let them know how you're going to be supporting that. How long will they use it for? When should they follow up with their provider to evaluate efficacy? I plan on having the patient touch base with you again in 3 months for a recheck on their A1C, lipid panel, and fasting blood sugar, et cetera, et cetera. Why is requesting a prescription such a hurdle? Again, I feel like dietitians feel uneasy asking for this because I've asked them and I know they feel uneasy. And some doctors are still unfamiliar with the benefits of off-label use of continuous glucose monitors. You can't know everything. This is fairly new. If you're watching this, you're kind of on the cutting edge of that. Please know, remember when I said that the FDA is not regulating doctors, they're regulating the manufacturers and the products? The drug reps are not, I don't think they're allowed to actually market off-label use of their products. They're not allowed to market it. They can say, here, you can use this for diabetes. And they will only say that because they're not allowed to say anything else. That's your job. You are a consultant. Hi, I'm a dietitian. I work with patients with prediabetes, PCOS, whatever. I have experience using continuous glucose monitors off-label for education and accountability and assessment. I find them to be, you see what I mean? You get to do the consult them, give the education, give them the resources. You might be the first person to introduce this idea to them. So give them the information that they need. I know this is a hurdle, but the benefits of looping in your patient's doctor is, one, if you want them to use a continuous glucose monitor, the price is the best this way. From a pharmacy, it can be as low as the base price for these sensors is about $39 for 2 weeks. So that's like $80 for a month of use. And most of your patients are going to use it for 1 to 3 months, just as education. If they have to get a subscription through, there's other companies like Levels, Nutrisense, Signos that have great products, but it's a lot more expensive that way, right? But they have a nutrition professional or coach or dietitian who can help interpret their data for them. So this price is you can't beat it. This could improve your patient's care and relationship with their doctor. This kind of gives your doctor a whole nother tool and a way to support their patients. And it allows your shared patient to take a greater responsibility for their health care, right? Makes them a better advocate. And it could just really jumpstart their relationship with their provider and improve the conversation that they're having. And simply, for your business as a dietitian or nutritionist, it could result in more referrals for your practice. If the local provider knows that you provide this service and you're helping them get good outcomes, why wouldn't they refer patients to you? So create a letter. Use your letterhead, make one, use Canva, use something. Keep it brief, clear, and informative. Give them your assessment briefly. Tell them your plan briefly and how a continuous glucose monitor fits in it. Give them prescription request. Be precise and include prescription codes. Make it easy. Again, doctors have a lot on their plate and they have 10 or 15 minutes to do it. No one likes to chart. They're going to pull a drop-down menu for a continuous glucose monitor and likely hit a glucometer because that's what they use the most. Even when I've included prescription codes on a letter, I still get them recommending glucometers. Big deal. Just like send another note back and say, oh, make it this prescription instead. Okay, everyone makes mistakes. It's not a big deal. So that's what I have for you. But I want to get you started on this. I'm going to put this in here. I have got a good handout, a good free booklet for you on how to use CGM in your clinical practice. I am going to add it to the comments here. And I'll put this in the comments later on for the replay on YouTube and whatnot. This is a free guide, 3 steps to using CGM in clinical practice. So I go through some of this, but I go through a lot more detail of how you can get set up doing this yourself. And for those of you who are real DIYers and feel really confident in getting this going for yourself, this might be all you need, and you might be able to figure it out yourself. If you need more support and have more questions for me, the best place to do it is my free Facebook community. It's called Using CGM in Clinical Practice. It's a group. I moderate it, and I share this video will be stored there, and I answer people's questions. And so that is the best place to find me, is to find me right there. I have trainings that I do. I call them fast track for using continuous glucose monitors in your practice. I help you set up with a continuous glucose monitor. And then, I provide a couple of live Zoom calls. So I teach you how to do all the tech support in one call. We have a long call where we all kind of practice troubleshooting the data and using LibreView together. And I show you how to do that. So it's like an online clinic for you. And then we have another Zoom call where I kind of help you get that set up for everything. My next one starts on November 4th, 2022. So you can still get into that. If you can get a prescription, please feel free to jump into that. I put a link there, but then there's a waiting list. So if you're watching on replay, if you're not ready now, the wait list I just posted for the next training is up, and we'll do that again. We'll do that early in next year probably for you, but I have a lot of resources for you, digital guides, but I just want to make sure that you're getting the support you need to do this, because I think especially for nutritionists and dietitians, this is very soon just going to be a tool that all of us have in our toolbox to use with people as it's appropriate for education of our patients, assessment, and some accountability. I have found it to be an incredibly helpful tool. And it gives everybody better outcomes. And I think it's really useful for us. So as I said, I put the links here. I'll include them in the replays, but please put your questions in the comments where you're catching this, and I'll come back and try to answer those the best I can. Okay. Thank you very much for listening. Bye.